The head injury is a result of the direct blow to the head, which is forceful enough to cause a trauma. That can include fractures as well as very rare injuries. So, all of these head injuries have some post traumatic factors that basically come into play after the trauma has occurred. Now, these factors can be basically they can be just after the trauma and they can be long term. That is basically after a period of time has passed on, for example, 3 to 4 months. So we have to consider these post-traumatic factors as well, and they're very important and they have an impact on the quality of life the person is leading after the trauma has occurred. Now, the force required to cause the fracture to the skull. It is very important what kind of force was applicable to cause the fracture of the skull. The post-traumatic epilepsy is observed in a lot of patients after the trauma to the head or the spine, and the post-traumatic infections are also a part and parcel of the trauma to the head injuries. So all of these are discussed in detail over here. The force required to cause the fracture of the skull. So if we have a look at this diagram, basically it is dividing the skull bone into the external table. Then we have the dipole, that is basically a trabecular or a spongy bone. And then we have an inner table, that is a more compact bone. So it's basically a sandwich phenomena. And we see two compact bones on either side and a dipole, a trabecular or a spongy bone on its middle side. So this is the basic anatomy of the skull bone. The studies of the biomechanics of the temporoparietal skull fractures are discussed in detail very widely by this Ugandan and Pinter phenomena, in which basically both of these scientists discussed in detail what are the forces that are required to cause the skull fractures. The adult head basically weighs between 3 to 6 kilograms, averaging 4 to 5 kilograms, that is around 10 pounds. So that we have to keep in our mind. And when following through about 1 meter, that is around 3 feet, so that the frontal area strikes a hard surface. So that was the first rule, that a person, the height that is more applicable to the skull fractures is around 3 feet. There can be a lot of variations to this height also. The impact injury, basically what they decided was 64.5 nanometers over here. That is around 47.6 feet to pounds that basically develops the skull fractures. Now, only a small additional amount of energy above that is needed to cause a single crack that is required to cause multiple fractures. So even a single crack will initiate the multiple linear spiderweb mosaic pattern of the skull fractures that we usually see after the head trauma. So after discussing the four mechanics for the formation of the skull fractures, we'll be moving on towards the dangers that are basically a part and parcel of these fractures that are caused in the skull. When the crack passes through an embedded meningeal artery, basically over here you can see the sulcus of the meningeal artery over here in this diagram, radiological examination, causing a meningeal hemorrhage. So basically, if we have a skull fracture, it can even cause a meningeal hemorrhage, or the meningeal artery can be damaged in any sense. So the post-mortem traumatic epilepsy after the head injury is basically the mainstay whenever we have a head trauma. So over here in these MRIs, you can just see, you can basically focus on the epileptic lesions that can basically cause the post-traumatic epilepsy after the head injuries over here and even over here. So what happens is a late effect of a depressed fractured skull can be the post-traumatic epilepsy. And it manifests as a tonic-clonic fits. So it's basically a generalized tonic-clonic type of seizures that are seen in such patients. And infections following the skull fractures, they're also a part and parcel of the head trauma. by the direct spread through a compound fracture where there is a contaminated scalp injury. So basically, what type of fractures can cause these infections? It can be an ring fracture. Now, the ring fracture is basically the fracture to the foramen magnum, and which is usually a part and parcel of the fall from the height. Because whenever the stress is not contained by the feet, basically it is passed on to the base of the skull, and then we come across the ring fracture, and that will cause a way through which the organisms can pass on to the brain, and that can cause the infection to the brain. Then another type of the fractures can be the fractures to the cribriform plate, that is also the base of the skull. That is basically involve the bacterial organisms from the nasal cavities, and they can enter to the base of the skull into the brain, and that can cause the brain infections again. Then we have the fractures to the frontal sinuses and to the paranasal sinuses even. They can also cause the infections to the brain. So all of these fractures, all of these head traumas can cause the contamination of the scalp or the contamination of the brain. And the contamination of the scalp injuries can again cause the infection of the brain. As I was telling you, the infections from the cribriform plate. So this is a diagram which is showing the relation of the cribriform plate to the contamination. As you can see, this is the nasal cavity, and if this cribriform plate is fractured over here, it can cause the contamination of the organisms from this nasal cavity to the brain. Then we have the olfactory tract over here, the olfactory bulb, and then we have the olfactory nerves over here. So by spread from the nasal cavity, when a fracture of the cribriform plate has allowed the communication with the interior fossa. Now here you can see, this is another diagram, as I was already discussing these sinuses, which also come into play. As you can see over here, we have these frontal sinuses over here on both sides. And then we have the ethmoid sinuses over here, and then we have the maxillary sinuses over here. So if we come across a fracture of these frontal sinuses, or in cases of the ethmoidal sinuses, they can basically contaminate from the nasal cavity, and that can pass on the infections towards the brain. And then we have the maxillary sinuses even over here. These fractures of these maxillary sinuses even can contaminate organisms from the nasal cavity and then through the brain. Over here, the frontal sinuses and the sphenoidal sinuses. So these two sinuses are basically the mainstay. They are more closer to the brain structures, and they can pass on infections more efficiently if we have the fractures to these. By spread from the fractures that involve the paranasal sinuses, that's very important. It can be any sinus as a general rule, and such as the frontal or the ethmoid, or from the mastoidea cells, or from the middle ear cavity. So these are basically the ranges of the places from where the organisms can be passed on. So in this section, basically we discussed the post-traumatic consequences that can be encountered by the person that if he had an injury in the past. Even a lot of consequences can be quite short-term, and then we can have the long-term consequences, and how can we deal with them. Thank you for watching sqadia.com.